At the beginning, I wanted to be a surgeon. And then one of my uncles back in Tanzania was like, you know, you can be both. You can be a dentist and you can be a physician. You can do both. So I looked into oral maxillofacial surgery, which is what I do. So I became a dentist first and an oral maxillofacial surgeon. And I actually, in a weird kind of way, I enjoy working on teeth. Some people say, oh my God, you look at people's teeth every day. I do. And I love doing it. Yeah. So that's how it started, you know. My uncle encouraged me and here I am. I'm doing dentistry.
And you're in this new 3-story building right now. So kind of talk about the journey of how you got here.
Wow. It's a long journey. So for those who want to be encouraged, well, one, you go through your high school, your college, and then once you have a passion for something, you have to first like it, then you start investing on it. There was a lot of savings involved between myself, my wife, our family, and also wanting to grow.
And when it comes kind of going back to the Black History Month, people in the Black community specifically kind of put their dental health last. Why do you think that is?
Yeah, you know, I think it's a matter of priorities, education. I encourage everyone, you know, especially those in the Black communities, to first take your kids to a dentist when they're very young. Like we took our kid when they had their first teeth in. They were like 3.
Yeah.
So if you start them that early and then every 6 months they go to their dentist, then it becomes routine. And I feel like part of what's missing is most people start going to the dentist because they have a toothache. It's too late.
Yeah.
You're starting with pain. So your first experience with the dentist was a tooth being pulled. And it should have been a cleaning, a whitening, smiling. And you're showing up and there's nothing to do. And I think that would make much of a difference in terms of how people perceive dentistry if they started early, especially in childhood.
And you touched on, you know, when some people come into your practice and they see you and they look like you and they're like kind of thrown off. Kind of talk about those type of experiences that you've had.
I see patients of all ages, all races, but every now and then when I see someone who is of the same color, they walk in, they're like kind of, oh, he's Black.
Yeah.
Yes, I am. And so it's good to see your own at times, especially on younger generation. They are encouraged. The questions are, how did you get here? What kind of courses did you have to take? So it's refreshing. I love it because I would love to be a role model to anyone who would like to do this, Black or white or any color.
Yeah. And if some of, you know, parents out there, some of the older generation out there at home sitting there and watching this special tonight and wondering what kind of advice you have for them when it comes to their teeth.
Number 1, brush after every meal. Number 2, see your dentist every 6 months. And number 3, sort of develop that relationship once you find a dentist you like. I think it makes the whole experience much easier for you. And if you're not sure, well, call us. Maybe you can answer some of the questions. Yeah.
I feel like I'll be calling you.
For what? You've got a perfect smile.
I was waiting for you to say that.
You do. I'm not just saying that because you are interviewing me.
I appreciate it. I think the last word of kind of what's something that one word you're feeling during this Black History Month and why?
Wow, one word.
Yeah, I know. That's usually the one I get.
Blessed. Honestly, I am very blessed to be here because there's a lot of people who are working very hard every day and they are not blessed the way I am. And so when I think about the struggles that, you know, our ancestors went through and what we are still going through as a community, to be here, being able to go to work, do what I love to do. And honestly, I could do it for free, but get paid for it. So I'm thankful.